In terms of your activity when you go home, the most important thing is to keep yourself up and moving. One important aspect in the early postoperative period is the use of your arms and weightlifting. You will be taught by the nurses and the staff on how to get up without using your arms. This is very critical because the breastbone has to have time to heal. And overuse of the arms and overuse of pressure on the arms can affect the breastbone healing.
Please try to stay active. Walking is probably the healthiest and best thing that you can do for yourself, one in terms of getting your bowels moving, getting your lungs expanded, helping you recover faster. Initially you will be quite fatigued with it, but as you start getting more back in condition, you will find that it's easier and easier to do the walking.
I always tell my patients that the more they walk when they go home, the sooner they're going to bounce back and have a full recovery. As far as return to work, I think that as a blanket statement from our practice, we usually tell patients they're going to be out of work for 3 months. Most of us are quite flexible on this policy, and it's highly contingent on what the source of employment is.
We really don't want you doing any heavy lifting. Your breastbone is divided, so it's vulnerable to any heavy lifting. So if you, for example, lifted something like this right in front of you, you wouldn't be putting too much stress on your breastbone. If you lift it at arm's length, obviously you're going to be stressing that bone a lot more. So some of these things are common sense in terms of how you lift, as well as how much weight you lift. So we'll be giving you a schedule of how much weight you can lift over the course of your period of recovery. By 6 weeks, that bone is pretty much starting to knit, and by 3 months, you can do pretty much anything you want. The bone is healed. It's just like a broken bone in your leg. You can't, you're going to have a cast on it. You're not going to be able to walk on it without a crutch for at least 6 weeks, and then after that, we don't want you running for at least 3 months. And so it's just the time it takes for the bone to heal. It's not that you're going to do anything bad to your heart. The other thing that people are embarrassed to ask about, but often want to ask about, is sex. Sex is not a problem after a heart surgery. Again, as I said, you're not going to really damage your heart. You may see that your heart rate goes up and so on, but you're not usually going to do anything. You're not going to do anything that's going to damage your heart. What we do recommend, however, is that from a sexual standpoint, you're the partner on the bottom, just because we don't want you resting on your arms, especially with the breastbone being recently divided and starting to heal.